Our great pleasure to be here today, and we're honored to host this chat with Dr. Tedros Ghebreyesus, Honorable Mutahi Kagwe, Health Cabinet Secretary of Kenya, and Honorable Dr. Daniel Gamije, Minister of Health of Rwanda. So all three leaders are here, of course, as we know, in their own right, and as representatives of their countries, and more importantly, as champions of health for all. They have firsthand experience in leading the UHC agenda and in responding to the COVID pandemic. I will first turn it over to Desta for just a few questions to Dr. Tedros, and then we'll proceed with both CS Kagwe and Dr. Gamije. We're thrilled to have all three of you here with us today. Thank you and welcome. Desta?
Thank you so much. It's
I
always a
would,
pleasure.
sorry.
Yes,
Sorry,
Dr.
Desta.
Tedros.
Sorry, Desta, for interrupt. I have already spoken, so I would prefer if ministers could start and then I will follow. Otherwise, I shouldn't monopolize the. Thank you.
Then in that case, so Dr. Tedros, actually, in that case, we can certainly move to the ministers. The only question that I had, and perhaps you can think about it and come back to it at the end, is we heard His Excellency President Uhuru Kenyatta emphasizing the importance of political will and leadership as a critical driver for social and economic development. So we know you've been passionate and vocal on the importance of political will to drive and, prioritization of health by government. So you've even published a report on that. And perhaps you can just think as our honored guests, the ministers discuss, just give us some thoughts. What are some examples which come to mind of, how Africa is doing in this light? So you don't have to answer it now. We can certainly move on to the questions for the ministers, but just keep that in mind and we'll come back to that. Is that okay with you?
Okay, that would be great. Thank you so much. Thank you, Desta.
Thank you. Lola?
Sure. So our first question will go to CS Kagwe. CS Kagwe, this last year, as you know firsthand, has been quite challenging for so many countries and individuals across our continent, especially for women and girls who have been disproportionately impacted by the COVID pandemic. In your perspective, what have been some of the key lessons learned, especially here in Kenya? Over to you, CS Kagwe.
Thank you. You can hear me?
Yes, we can hear you well.
Thank you very much. First, again, I want to recognize and thank very seriously the leadership that we have with us, Dr. Tedros, John Kengasong, and I want to congratulate John for the new appointment again, and to thank you for what you have done. To an all protocol observed. Let me go straight to the lessons that we have learned. I think, and they are both positive and negative. I think the first, in terms of the positives, is what President Kenyatta alluded to just a few minutes back, and that's to do with the fact that we have learned that with just changes in the behavior that we have, and especially in terms of hygiene, and in terms of how we live at home and elsewhere, we can do a lot in terms of prevention. That has led to us as a government to revive our policy in terms of what is the best way to prevent disease and fight disease and infections. And that is prevention, prevention, prevention. And I think that for too long, we have laid too much emphasis on cure and provision of medicine and provision of hospitals, and prevention is actually the key. What we want to do is to stop people from going to hospitals, is to stop people from getting medicine. And the only way to do that is to lay special emphasis on prevention. And to that end, what we are doing is introducing family health, where we want to take medical care to people's homes rather than people come to institutions of medical care. And that's a fundamental shift in the way that we run healthcare in the country. The second thing, and it was alluded to as well a while back, I think has to do with communication. And I think that one of the things we also picked up is that communication and communicating with citizens is not just a mandate of policymakers, but I think that we should expand that to include as many of our experts in communicating as possible. The authenticity and trust that people have, for example, with doctors communicating with them directly. And this is what we did. We put our doctors on TV, we put our frontline workers on TV to communicate directly, rather than just us, the politicians, being on TV. We wanted our doctors to be on TV. And that created a certain element of trust as far as whatever message we had was concerned. I think for me, the other very important one is that we learned that in a crisis, you can really just depend on yourself or your continent. You cannot depend on the international community to resolve your problems. And I think that towards that end, one of the things that we really like to see is enhanced local manufacturing. And I'm very happy today that some of the sponsors of the current meeting we are in is the International Federation of Pharmaceutical Manufacturers and Associations. I think I would like to send a clear message to them that one of the things that we have discovered is that it is possible for you to have money and not to have supplies. We all know what happened. And if there is any minister in the continent of Africa who will tell you the most frustrating times that we lived through, the most frustrating, the panicky sides we went through is when we did not have PPEs, yet we are getting cases in our hospitals. We did not have reagents, yet we wanted to test. Because why didn't we have reagents? We don't have reagents being made on the continent. Secondly, the equipment that we have are closed systems that we cannot use in an open way, getting reagents from anywhere. They are closed systems. The countries where we could get the closed system reagents had themselves banned the export of reagents. So we have got a system, we have got a machine, but the reagents can't come to you because it's a closed system. So we learned that, and therefore moving forward, there are a number of things I think that come to mind. And we must be brutally honest with ourselves about this. First, as a continent, it's absolutely crucial that we do whatever we can. We develop a cooperation as a continent so that we can have plans that are economically feasible to investors, provided that we know that we can buy from them as long as they are within the African continent. I think that's something to think about moving forward. The second thing to think about moving forward is that we have got to structure an economic environment, particularly the taxation regimes, that allow for and favors local production of pharmaceutical products and commodities over and above those imported from the outside, which means then, three, that we are prepared to cooperate with those organizations, those pharma companies, so that instead of them just locating the organizations out in Tokyo and in New York and other Western nations, that they can also begin to think seriously about cooperating with us on PPEs, on PPP, on direct private sector involvements, so that we also can have a share of those organizations and farmers operating from the African continent. Because four, it informs also the fact that we were exporting jobs for simple things like malaria nets and so on. We are exporting jobs at a time when we are already devastated by COVID-19 in terms of increased joblessness. So to me, it appears that this cooperation we have learned from COVID-19, the experiences that we have gone through, have made us more aware of our vulnerability. They have made us more aware also of our potential, especially because now we make a lot of those things. We no longer import PPEs, we are making them locally. But I think that it has got to be something that we think about consistently, comprehensively, and sustainably. Because what we don't want to do is to get caught with our pants down come the next pandemic. And it is coming. There will be another one. So are we going to be in the same spot or are we going to have learned something and moved on?
Thank you, CS Kagwe. I think those were some really, really key lessons for us to take away. We are actually discussing some of those during this conference. So I would encourage delegates to look up for those sessions on manufacturing, on entrepreneurship, etc. But coming now to Dr. Daniel, all the way, if we just think back to even His Excellency President Kenyatta's address to us today, and CS Kagwe has mentioned this as well, it is extremely important for us to ensure access to healthcare services. It is important for us to make healthcare available. It is important for us to make sure that we ensure that no one's left behind. So thinking about Rwanda's policies, Rwanda's plans for UHC towards achieving health for all, how is Rwanda's UHC plan centering the voices and the needs of those who are often overlooked? Dr. Daniel?
Thank you so much. The experience of Rwanda is that after tragic events of the genocide against Tutsi in 1994, the government decided to go for a policy which include everybody. No one should be left behind for any reason. And for that, initiatives were taken to make sure that policy dialogue will be including everybody, to ensure that, especially for the healthcare access, we make sure that even a poor person can have access to care. And for this reason, the government developed a scheme called community-based health insurance, where for poor people, the premium for their adherence to this scheme is paid by the government. And it allows them to be treated from the primary health care up to the tertiary level of care. This is an initiative for avoiding out-pocket catastrophic expenditure, which really might be a reason for excluding this kind of people at the level of care. But there are also other reasons for exclusion. Apart the financial barrier, we might have also geographical barriers, which can exclude people just because they are in remote area. So the government regularly is mapping the country so that wherever there is a need for a health facility, being an hospital, being a health center, being a health post, this facility is constructed, but with clear sharing of responsibility. The central government is in charge of constructing hospitals, but local government is in charge of constructing health center and health posts. And this is part of a performance which is signed annually by central government and the decentralized government with His Excellency the President, so that at annual basis, each level will be accountable for what they signed to achieve for increasing geographical accessibility for everybody to health care. There are also other barriers which are more related to culture, and especially we can see it in some services like the family planning, where we still have 14% of unmet need from our recent demographic health survey. Clearly, we need to increase dialogue, and especially with people who can influence, especially religion, civil society, to make sure that everybody is concerned and service can be accessible to different categories of population. There are some services in family planning which are not given by some of our partners, like religions. We need to make sure as a government that we have alternative possibility of giving those services through public health facilities near to religious faith-based health facilities, at least to ensure that population can have access to an alternative solution. And also, we need to, again, to mobilize different sectors so that, because the government can't do everything, the mobilization of the private sector is really key. Today, we can see that we encourage the private sector to invest in health, especially in tertiary healthcare, and also in primary healthcare, where the government can be in PPP model with those private partners, by facilitating them and give some incentives, like giving them land, giving them some tax exemption, so that private sector is attracted to come and invest in health, so that will help to address some issues related to geographical accessibility, again, for health, for our communities. And final, it's about some legal barriers. Today, we have some legal barriers like related to the reproductive health age. We have a big issue of pregnant teenagers. For them, the fact that they can't have access to pills or any other contraceptive method just because the reproductive health, which is 18 years, can't allow them to go in pharmacy and be receiving those pills. This is a limitation. So we are discussing with parliamentarians so that this legal barrier can be removed, so that a young girl can have access to different contraceptive methods, because we know that they are sexual active. Starting 14 years, they are already sexual active. So this kind of legal barrier should be removed, just because we can't only rely on engaging them, discussing with them, because at the end, we just discover that each year we have an unwanted pregnancy among teenagers. Thank you.
Thank you so very much to both of you, Honorable Kagwe and Honorable Ngamije. You've raised some really important points and issues in your comments, and we appreciate that. If we were to just come back to you both, and you can, perhaps the Honorable Kagwe can start, and Honorable Ngamije can also share his opinions. Since you've raised a lot of important questions, what do you think is the one thing that not enough people talk about when it comes to leadership in global health? And then why do you think that is the case? So I think there have been quite a number of things raised, but in your opinion, what is the one thing that people don't talk about? And Honorable Kagwe, maybe I turn to you. Thank you.
Thank you. I am not sure that there is one thing that we don't talk about. Perhaps there could be something that they don't emphasize about. And for me, obviously, leadership is everything. And at this point, I mean, you know what has happened with Dr. Tedros when he's been fighting, from his office regarding the reagents, first to begin with. Secondly, to do with the vaccines. And it's an example. If he wasn't fighting as much as he does, and if he wasn't, and he didn't put as much emphasis on the equity aspect as much as he has, but my position is that we probably wouldn't have, we would not have the vaccines here at this time. The second thing I think and I think the one thing missing, if you ask me, is that in the previous arrangements within the African continent, we have tended to operate singularly in a silo mentality, where we believe that a geographical boundary is in itself enough to allow you to do the things that you want to do and to negotiate on your own. Now, whereas bilateral negotiations have their place, we have learned one thing, that leadership must work together on this one. And on other global health challenges that we are going to have, we must work together. We must become a big shareholder in discussions on the healthcare platform and on the healthcare boardroom. And the only way you become a big shareholder is when you work together, all leadership combined into one. And speaking as an African continent, we will demand a lot more, we will command a lot more than we currently are. So leadership, bringing leaders together, is always a problem, because essentially everybody is a leader and everybody thinks that they are leading where they are. And the challenge, therefore, is how do we allow ourselves, subdue ourselves, so that we can be able to take on a common platform and negotiate and work together within the African continent. If we can do that, we will achieve a lot more than we are even dreaming about. This is a clear situation in leadership where 2 + 2 will equal to 5. I submit.
Thank you so much, Honorable Kagwe. This was indeed really important, working together, leaders working together as shareholders, which is actually a term I have not heard. But thank you so much for raising that issue. And let me just turn to the Honorable Ngamije and, your thoughts on this. What is the one thing not enough people are speaking about when it comes to leadership in global health?
I think one thing that people, they don't speak a lot.
Okay, Dr. Daniel, I think we are having a little sound difference. Can you hear us? Are you with us? Okay, I think there is a sound a challenge with your sound. I am not hearing you, and perhaps our listeners may not be hearing you as well. So, Dr. Tedros, can I circle back to you while we are waiting for a response from Dr. Ngamije? Perhaps you can just share your thoughts on what you've heard.
No, thank you. Thank you very much. I think the lessons Minister Mutahi Kagwe and Minister Daniel Ngamije raised are very, very pertinent, and I fully agree. Maybe one thing I'd like to stress is on the vaccine equity and what Minister Kagwe said, especially on building Africa's manufacturing capacity, local production. That's very, very important. We have seen it from this pandemic, starting from the PPE and now with vaccines, the lack of equity in distribution is affecting actually many countries, especially the developing countries who do not have manufacturing capacity. So I think that's a big lesson, and I would like to stress that. But when we talk about manufacturing capacity, the other lesson is, it has also been said, the national capacity starting from prevention, from healthy lifestyle, and then prevention, and the rest is key. So the national capacity includes, of course, preparedness. When I say national capacity, it's what we're discussing today, universal health coverage. When I say national capacity with an universal health coverage, it means strong primary health care that encompasses prevention. And then national capacity means things that are done in terms of preparedness as well. So for many countries, I think the situation could have been better if there was better national capacity. By the way, when I say national capacity, it's not just to countries in our continent alone. Even because of lack of national capacity, especially in public health, even the most the countries, even the most high-income countries have been affected because their investment was more on medicine than in public health or in primary health care. So that's, I think, a big lesson, not only for our continent, but including for the rest of the world, strong national capacity. Then the other lesson is, when we say political commitment, it could be investment, it could be many things. But the other very critical thing that we have seen and which affected the pandemic response is when politics deviates from science and evidence. Instead of supporting the experts, instead of supporting the evidence, instead of supporting the science, it goes contrary to science and evidence, and that actually helps in spreading the virus. That's a big lesson which we have seen globally when some leaders were just moving the other way, contrary to what science says. And of course, in our continent, we haven't seen that, but in many countries, in a good number of countries, actually, we have seen where the experts were not getting support, but even the worst politics was moving contrary to science. I think we have to take that as an important lesson, because you cannot mobilize the community, you cannot pass the same message to the citizens if politics and science are not actually supporting each other. I think Minister Daniel Gamje is back, so I'd be happy if he could take the floor. And then I would, if there is time, I can add, but just maybe a couple of things from what you said, Desta, earlier is political will is very important. Political commitment is very important. And we see it, by the way, the two countries today are the best example in Africa, who are really doing their best, both Kenya and Rwanda. And their commitment to universal health coverage is very clear. And it comes from their commitment, belief that health is a fundamental human right. And that, I think, when the political will comes, not just in terms of only investment, but in a belief that it's a fundamental human right, that becomes, that opens actually several doors, and that can help us to really achieve universal health coverage. So on political commitment, I think the two are good examples, and they have already been saying it, but the central aspect of it is health and the human rights. And with the pandemics, we have already seen the centrality of health. And I hope the whole world has learned its lesson now, not only our continent, and that health will be put at the center and will be taken as a serious rights issue and a means to development. With that, thank you so much. This time, back to you.
Thank you. And I think we have the Honorable Gamenji with us. So maybe we lost you earlier, maybe we give you just a short moment to respond to this question that was put forth about the one thing that is not talked about, and we will wrap up this session. Thank you so much.
Thank you. I was saying that leadership in global health, leading to kind of international partnership, can't do everything. It can't replace key function of each country in defining vision for health, in defining objectives where the country wants to go, in allocating resources, and in mobilizing stakeholders for implementing the health agenda, and make those stakeholders accountable. These things, you can't import them from outside. It's from the country. It's from the vision and the commitment of each country. And generally, people don't want to say it, and for a simple reason. Sometimes it's a good reason for explaining any failure, that we failed because maybe we're expecting this from outside, why we should normally plan it in country and make sure that those external resources, being financial, being technical, are just coming to facilitate implementation of what we decided to implement as a country. Thank you.
So thank you so much, Honorable Dr. Daniel Gamije, CS Kagwe, and thank you, Dr. Tedros, for honoring us, for giving us your time. Today, we are just extremely glad that you took this